Dr. Abramson says cardiologists are so focused on how these drugs prevent blood vessel disease, they often overlook the other problems caused by statins.
People are more than their cardiovascular system. And what we really want to do is improve people's overall health, longevity, and their risk of serious illness. If you look at overall health, we haven't done anything for them. Now, do people want to take a statin to trade one cardiovascular event for some other very serious illness, in other words, no net benefit, and expose themselves to the risk of harm from the statins? Do you want to do that? I think it's a bad deal. If somebody has a particular fear of heart disease and says, look, I don't care if I get diabetes. I don't care if I have muscle symptoms. I don't care if I can't exercise the way I want to exercise. I do not want to have heart disease. Fine, take a statin, but understand that that's why you're taking a statin, not because it's going to improve your overall health.
Cardiologist Dr. Ernest Curtis says the absolute benefit of statins is so minor that it's unlikely to be because of their ability to lower cholesterol. He says statins probably work through other mechanisms.
It seems very likely that the amount of reduction that they saw with the statin agents could easily be due to its effect on the blood clotting and possibly even the anti-inflammatory effect, and have nothing to do with the cholesterol.
Dr. Galom has scrutinised the data, and she's even more sceptical about the value of these drugs, especially in women.
Right now, the evidence has not supported benefit to women, even if they have heart disease, in terms of mortality and all-cause morbidity. It has not shown benefit to elderly, even if they have heart disease. In fact, in the 4S trial, there was a 12% increase in mortality in the women in that group who were assigned to statin rather than placebo. So the evidence really doesn't support that the benefit is the same for women and for men. And on top of that, women are at higher risk of complications from statins.
Should women take cholesterol-lowering medication?
In general, no. Now, there may be exceptions. Medicine actually does have an element of art. And if women are from a family with severe familial hyperlipidemia, where a lot of people are dying from heart disease in their 30s and 40s, that's a group where I would say there is an art.
There are now calls for patients to give written consent before taking a statin.
If you do plan to give statins to women, to elderly, to people at low risk, they should sign a consent form saying they understand that they're receiving a drug that will not extend their life, but will only shift the cause of death. I think patients have a right to know that before they agree to take on a medication.
The National Heart Foundation of Australia agrees that people are being prescribed statins unnecessarily.
I would agree that there are people in Australia today who are being treated for cholesterol where their cardiovascular risk is not high, and you would have to question whether they should in fact actually be on that.
A report estimated around 75% of people taking statins are in the low to moderate risk category. And according to these researchers, that means up to 30 million people are taking a drug that won't offer them the benefit of living any longer.